Discussion here on our reproductive systems. Okay, reading through the male and female reproductive organs work together to produce what we call offspring. So in other words, make babies. Now, we're all built to make babies, to produce offspring, whether we choose to or not. Obviously, that's a personal life choice. Men kind of have it easy. Males only really are required for the act of making the baby. The sexual reproductive process. As far as women go, they have that responsibility, but they've also got the responsibility and the reproductive organs that are needed to sustain the growth of the embryo and the fetuses, make make the baby grow inside of them, and then give birth. Childbirth is obviously a very, very arduous process. And then females have mammary glands, which we'll talk about on our last slide. That actually be the last thing we talk about, that help the baby and give nourishment to it after birth. And as far as men go, we can have sex and then walk away. Obviously, this is all life's choice stuff. I'm not going to get into any of that. Sexual reproduction is a process by which organisms produce offspring by making germ cells called gametes. Gametes are, in other words, are sex cells, and that would be the eggs that females produce, the sperm that men produce inside of their what we call gonads. I'll get into all that here in just a minute. When those sperm and eggs unite, we call that fertilization, and that results in a single-celled zygote being formed. This is what we all begin our life as. One cell that then becomes two cells that then can become four, and on and on and on, eventually developing into us as full-fledged adults capable of reproducing our own babies. Males and females have anatomically distinct organs adapted for producing the gametes for facilitating the fertilization, and females, like I said, sustaining growth of the embryo and fetus. We can break down the kind of organs of the reproductive systems into three categories: the primaries, the accessories, and the supporting structures. Primary sex organs are also called the gonads. This would be the testes and ovaries. Testes are a male set of organs. Ovaries are a set of female organs. Talked about these before back in our endocrine system when we learned about the hormones that they produce. Here we'll kind of talk a little bit about that, but we'll kind of be more focusing on their role in producing sperm and eggs. The accessory reproductive organs produce substances, protect gametes, facilitating their movement. Include ducts that store and transport gametes. Men have ducts like the vas deferens that carry sperm. Women have the fallopian tubes, or oviducts as they're also known as. And then glands produce substances protecting the gametes, facilitating their movement. We'll talk a lot about things like prostate gland in men, bulbourethral glands in men. Women have the different glands as well that we'll get into. Supporting structures assist in the delivery of gametes or provide a site for the growth of the embryo and the fetus during pregnancy. I didn't specify, but I imagine everybody knows the penis is a male structure, the uterus is a female structure. Gynecology is a specialized branch of medicine concerned with diagnosing and treating disorders of the female reproductive system. Andrology is a branch of medicine that deals with male disorders, especially infertility and sexual dysfunction. Urologists are clinicians that diagnose and treat diseases and disorders of the male reproductive system. So just a little information there, not something super, super important to know. What we're going to do is we're going to split the remaining parts of this lecture into kind of two categories. The first half of the lecture will be discussing men, and then we'll talk about you ladies out there. here in a few slides. All right, we're going to start with those primary sex organs of the male reproductive system, the testes. Testes with an E here at the tail end is plural. Testis with an I instead of an E there would be singular. A lot of times I just actually use the word testy, which it's not actually a word, but that would be the singular version. Testicles is another way to describe the testes. It's a pair of oval glands that are site of sperm production in men and are the only male reproductive organs with endocrine functions, secreting that hormone we briefly touched on earlier in the semester, testosterone. Their major role in reproduction is the production of the male gametes, what we call spermatozoa, just a fancy word for sperm, a process that is called spermatogenesis, which literally has the word sperm in it, and then ends with the word genesis, which is kind of fancy word for creation. So sperm creation or sperm formation is what that means. The testes develop in the abdomen, so up in that abdominal pelvic cavity, and they descend down into the scrotum through that inguinal canal. Thinking back to our lecture when we talked about the ab muscles, we learned that there were two little holes at the very bottom of those ab muscles. The inguinal ring, which was the hole that leads to this canal. It's kind of crazy, but the testes, even though they're located so close to the penis, really are very independent from the penis. And that's, illustrated here with the fact that those testes develop up inside of the male abdominal pelvic cavity, and then they descend down, or they're supposed to anyway, into the scrotum. Sometimes they don't. Cryptorchidism is a failure of one or both testes to descend. Typically leads to sterility, and it increases the chances of testicular cancer. One of the first things they do when a baby boy is born, obviously, this is, not the first thing, but one of the first things they do is check to see if they have been moved down into the scrotum where they belong. Okay, a couple of things to talk about that surround our testes aside from the scrotum that we'll get into on the next page. We have what we call the tunica vaginalis and the tunica albuginea. Okay, the vaginalis is a serous membrane partially surrounding each testis, derived from the peritoneum, and forms during the descent of the testes. Remember, the peritoneum is that membrane that we talked about as part of our digestive system. It's what's in the inside of our abdominal pelvic cavity. Collection of serous fluid in the tunica vaginalis is called hydrocele, which can occur due to injury of the testes or a structure we'll talk about on the bottom of the page called the epididymis. Tunica albuginea is a dense white fibrous capsule that's internal to the tunica vaginalis, and we can see both of those here in our illustration at the bottom. Okay, the vaginalis here on the outside, and then a little bit more interior to that is the albuginea. Okay, as far as albuginea goes, it has important extensions that penetrate inward into the testes. This is an interior view of the testes once we've performed a sagittal section, and it creates distinctive kind of compartments within each testis. So it's kind of like what we've seen with several other organs here the last few weeks. We've got a kind of capsule-like structure on the outside that penetrates inward and separates it into compartments. Each compartment is called a lobule, and you can see there are several lobules. We've only got one labeled here, but there are many of them, and inside of them are these what we call seminiferous tubules. Okay. Now, each of these extensions that penetrates inward from the albuginea is called a septum. Septum is singular. Septa would be plural, which I believe is how I have it written up here. Where's it at? Yeah, right here. So producing septa. or septum for singular, dividing into cone-shaped lobules. Let's talk about those seminiferous tubules. Look, highly coiled tubules. We find one, two, or three of them typically per lobule. And something very, very important is that these are the site of spermatogenesis. Once again, spermatogenesis, we just learned, is the production of sperm. Okay. Several types of cells exist within or around these seminiferous tubules. Spermatogenic cells are the ones that actually form the sperm. Spermatogenic sounds a heck of a lot like spermatogenesis. Spermatogenic cells are the ones that perform spermatogenesis. Kind of simple, straightforward there. Sertoli or sustentacular cells have several functions in supporting spermatogenesis. I won't really get into any more detail about that. And then Leydig or interstitial cells are important because they secrete testosterone, and they're actually located kind of between the adjacent and seminiferous tubules. So the sperm are created here, but they need to be transported to a separate structure called the epididymis, which is on the backside of each testis. And there's a kind of tube-like networking system that is going to carry those sperm to the epididymis. From the seminiferous tubules, the sperm are going to travel by way of a straight tubule or several straight tubules, because there's one connected to each of these seminiferous tubules. We call them straight tubules probably because they are nice and straight. They're really short, but they are nice and straight compared to the very coiled up seminiferous tubules. They carry the sperm to this thing that kind of looks like a capillary network, which is called the rete testis. Okay. And then from there, the sperm are going to travel to the epididymis by way of these kind of longer, straighter tubules called efferent ducts. And so what I just kind of described are this parts of our information. Straight tubules, series of short ducts, look at the seminiferous tubules. Rete testis is a network of ducts that receive the sperm from those straight tubules, and efferent ducts are about 12 small efferent ductules arising from the rete testis, carry the sperm to the epididymis. So we've been mentioning the epididymis. Its job is to be the site of sperm maturation and storage. So this is where sperm are stored and develop maturity, which takes about 2 weeks, allowing for the sperm to gain more motility. Better, kind of easier way to describe that would just be they're going to get better at swimming. Okay? Their tails are going to develop, and they're going to be able to swim up through the reproductive tract of the female and hopefully fertilize an egg. There are several parts to an epididymis. A tightly coiled region is called the ductus epididymis. There's also a superior, what we call head, a narrow midpoint called the body, and then a smaller inferior portion called the tail. So you can see the head at the top, then you got the body in the middle, then it kind of more tightly coils, forming the ductus, and then at the bottom is the tail. Okay. During ejaculation, smooth muscles that encircle the epididymis contract and force the sperm into what's called the ductus or vas deferens. The ductus or vas deferens is a muscular tube that delivers the sperm to the seminal vesicles. It is this tube that you can see found coming up out of the testes and is going to ascend out into the spermatic cord. This is a really cool tube. It is a very narrow lumened tube, so it's really skinny. It's well innervated by sympathetic nervous system fibers, about 45 centimeters or 18 inches in length. Obviously, the testes are not 45 centimeters or 18 inches away from the penis, and that's because this set of tubes, one from each testes, is not going to carry the sperm directly to the penis. Let me show you what happens. It's going to carry the sperm all the way up back into the body cavity, into our abdominal pelvic cavity, through that inguinal canal. It goes up and around the bladder, and then it starts heading back down, where it then dumps its sperm into that prostate gland that we show right here in that same picture that we saw at the end of our last lecture. So it would make sense if our sperm were carried directly to the penis, but that's not what happens. Okay? They get carried back into the abdominal pelvic cavity through that hole that we talked about previously. So it enters the abdominal cavity via the inguinal canal, passes around the bladder, joins with the duct for the seminal vesicles, ends at the ejaculatory duct. We'll talk about all those things on the next page. The dilated terminal portion of the vas deferens, called its ampulla. Sperm can be stored in the vas deferens until peristalsis or peristaltic contractions. Remember, that's like what we talked about, the digestive system. The smooth muscles that surround it force the sperm forward during ejaculation. When a man has a procedure when they no longer want to make babies, what do they have? What's that procedure called? Vasectomy. Guess why they call it a vasectomy? Vas deferens is what's, as they say, snipped, clipped, whatever you describe it as. Now that vas deferens or ductus deferens, along with several other things, are held together within what's called the spermatic cord that you see labeled here and over here from our cadaver pictures. This is just a supporting structure ascending out of the scrotum through the inguinal canal. It consists of, like I said, the vas deferens, but there's also testicular arteries, veins, autonomic nerves, lymphatic vessels, and a specialized muscle that we'll talk about here on the next page called the cremaster muscle. Overall, its function is just to connect each testis to our body cavity. As far as the pictures go, I'm not worried about you knowing, these over here, though this is essentially showing you the exact same thing as this, although it's kind of, impossible to see the tubules and all that wonderful stuff just because it's not zoomed in far enough. It's pretty cool to see. You can see that the testis and the epididymis are kind of completely independent of one another, although they're very connected to one another. And then you can see the spermatic cord very nicely. I do definitely want you to know this image, and I would say everything would be fair game, with the exception, don't worry about blood vessels and nerves. And everything else, absolutely something you should know. All right, continuing on with men, let's talk about the scrotum, which is a sac consisting of hair and superficial fascia that hangs from the base of the penis and encloses the testes. I mentioned a little bit about the scrotum on the previous page. It contains a vertical scrotal septum, which we can't see, and we'll see it here on the next page. Just divides the testes into the two compartments, the left and right sides. The scrotum functions to keep our testes, for you men out there, in an environment that's about 3 degrees Celsius below that of our body cavity. And that's because sperm, for proper development and storage, need to be a little bit cooler than 37 degrees Celsius, which is our, kind of normal temperature in our core. Two muscles help maintain this lower temperature: a dartos muscle that causes the scrotum to wrinkle up and kind of thicken itself up, which helps reduce heat loss when our external temperatures are cold. And when it's really warm, that muscle is going to relax and allow the scrotum to kind of stretch a little bit more and thin itself out to keep itself cooler. Cremaster muscle, I mentioned, is a portion of or is found and supported by that spermatic cord. We can't see it here, but basically what it's going to do, it's going to lift the entire scrotum and then the testes along with it, either closer to the body when we're cold, or allow the testes to hang farther away by relaxing when the body is hot. Okay. We can see the scrotum here at the bottom, but we don't see really any of those other things, but we do see them here on the next page. I'll kind of just point them out then at that point. All right, let's talk about the seminal vesicles. Vesicles, which is plural, are a pair of glands that are posterior to the base of the urinary bladder. I should say to the urinary bladder, to the base. I guess that's right. To the base of the urinary bladder. They secrete an alkaline fluid that neutralizes acids in the vagina, fructose that provides energy to the sperm, and prostaglandins that contribute to sperm motility and viability, as well as clotting proteins that cause coagulation. Coagulation is just a fancy word for clotting after ejaculation. We can see one of them here in our picture. Since this is a sagittal section, we can see half of the body. Here is one of the two seminal vesicles. Now, it's labeled, as you can see, this is where that line is going to. Right here is the tube that's connected directly to it. It's not labeled. So I would draw a line in right where I'm putting my cursor and label that as the seminal vesicle duct. Right here is the seminal vesicle duct. Now, on the previous page, we talked about the ductus or vas deferens, how it comes up and down and around the bladder. We said that it fattens itself out, becoming what we call the ampulla of the ductus or vas deferens just before it terminates. Here, that seminal vesicle duct and the ampulla of the ductus deferens converge inside the prostate, forming what's called the ejaculatory duct. So that's our next structure to talk about. There are two of them. One on each side, formed from the union, once again, of the ducts from the seminal vesicle and the vas deferens. Each of them passes through the prostate gland and empties into that prostatic urethra that we talked about last time. Function of them is just for sperm, and I really could put and fluid from the seminal vesicles into the urethra during ejaculation. Now, the prostate gland, we talked a little bit about last time, but we didn't really learn what it did. It's a single donut-shaped gland surrounding the prostatic urethra and ejaculatory ducts, and it's immediately inferior to, and I should say, to the urinary bladder. That is a mistake. It secretes a milky, slightly acidic fluid into the urethra that increases sperm motility and viability. But viability just means that the sperm are going to, live. Motility, as we said, ability to swim. I talked a little bit about how this gland likes to get bigger as men get older and can really kind of pinch off on that prostatic urethra, making it difficult for men to urinate kind of in a nice steady pattern. Last set of glands I want to talk about of the male reproductive tract are the lobourethral glands or Cowper's glands, which are positioned at the inner end of the penis just below that prostate. And they function to produce a clear alkaline fluid that lubricates the head of the penis, protects sperm by neutralizing acidity of any residual urine. They also secrete mucus that lubricates the end of the penis to decrease the number of sperm that are damaged during ejaculation. Very, very small. Here they are. Here's one of them anyway. This is where that pre-ejaculate fluid comes from, that clear fluid that trickles out of the penis before a man actually does, the forceful ejaculation. The urethra, we learned the other day, is a shared tube of the reproductive and urinary systems, carries urine from the bladder during urination as well as semen during ejaculation. We learned there's three parts to it: the prostatic urethra, then the intermediate, or as we also described it as the membranous urethra, and then the longest, as it passes through the spongy part of the penis, is that spongy urethra. Okay. And that leads the urine or the semen out through the external urethral orifice. Okay. Speaking of the penis, it's a cylindrical organ, passes urine and serves to deposit semen into the vagina. There's a lot to talk about with the penis, so we'll get into all that stuff here on the next page. So for now, before we move on to that next page, get your highlighters ready. Actually, what I would do, I'm going to have you guys just cross off the following. This is going to be easier to tell you what not to worry about, because there's a lot to know. So don't worry about the following. On the left side, the sacrum, the vesicorectal pouch, the coccyx, the rectum, and then the anus. A lot of that stuff we've talked about, very recently, digestive stuff. Okay, everything at the bottom you want to know. On the top right, the peritoneum, don't worry about it. Don't worry about the pubic symphysis. Don't worry about the deep muscles of the perineum. Everything else is fair game, either from our last lecture when we talked about things like the bladder. This is a ureter, although it's not labeled. I don't know why, but whatever. All these things down here as part of the penis we're going to talk about right now. All right, let's talk about the penis, which contains the urethra and is a passageway for ejaculation of semen and the excretion of urine. It's cylindrical in shape, contains or is consisting of three parts: the body or shaft, the root, and the glans penis. The body or shaft is what makes up the bulk of the penis and consists of three cylindrical masses of tissue. Okay. Now, we see the term corpora and corpus right away at the very beginning of those two structures. Corpora is plural. Corpus is singular. Corpora, there are two of them. Corpus is just one. But if I go back to the previous page, okay, we see corpus both places, corpus cavernosum, corpus spongiosum. Okay, back here we said it's corpora cavernosum. This is the plural form. Since there's only one labeled back up here, the corpus cavernosum is what it's labeled as. If it was both of them, like what's down here, we would have it labeled as corpora cavernosa. So cavernosa is plural, corpora is plural, corpus is singular. Singular version of cavernosa is cavernosum. That makes sense? Okay. So the two superior chambers are the corpora cavernosa, two masses of tissue that fill the volume of the penis, most of the volume anyway. We see here, this is a picture from a cadaver penis that's been essentially just sliced off. And you can see two very big chambers. At the center of them is a deep artery. That's where the blood's going to come in, which leads to an erection. It fills in to these sinuses and engorges the penis up to a point where the blood kind of gets trapped, and that's what leads to an erection. Okay. If I go back up to this picture, you can see essentially the same thing. It's not quite as zoomed in. There are the two corpora cavernosa, and you can see the little red dots are the blood vessels. Inferior to that is the corpus spongiosum, a single mass of tissue that encloses the spongy urethra. So kind of simple, think spongy urethra. Spongiosum is the mass of tissue that encloses that spongy urethra. Okay, the root of the penis is what attaches it to the perineum. Remember, the perineum is the floor of your pelvic cavity. There's several parts to the root. The bulb is the expanded base, or expanded portion of the base of the spongiosum. You can see it here nicely in our frontal section picture. And then the crura of the penis are the two separated tapered portions of the corpora cavernosa. Looking down here, we can see how they taper out, but we only have it labeled on one side, and it's labeled instead as crura as crus. Crura is plural, crus is singular. So that's where the term comes from. The glans penis is the enlarged end of the body. So in other words, this is what a lot of people describe as the head of the penis. It's the distal end of the corpus spongiosum. And there are several things to talk about it or with it. The corona here that's labeled is the margin where it starts to kind of get a little bit wider. And then what we show here would be a uncircumcised individual because it contains a prepuce, which is the fancy word for foreskin. Weight of the penis is supported by two ligaments. We can actually see them very nicely right here. Continues with the fascia of the penis, which includes the fundiform ligament. Fundiform ligament is kind of on both sides, arising from the inferior part of the linea alba. Remember, the linea alba is that vertical connective tissue that runs between your two ab muscles, your rectus abdominis muscles. The suspensory ligament in the middle there arises from the pubic symphysis. And actually, if I go back to the previous page, one of the things I had you cross off was the pubic symphysis, but you can see a connective tissue coming down from it is that suspensory ligament. So to kind of help hold the penis in place. Okay, as far as the pictures go, this is a really good one because you can see essentially everything really nicely with the penis, along with some structures back up internally, which includes the two Cowper's glands or bulbourethral glands. There's a singular prostate, and actually leads all the way back to the bladder. We can see all the different segments to the urethra, all the way to the external urethral orifice. This is a pretty good picture as well because it includes the testes and, kind of pick some of them apart so we can see, the different membranes and whatnot, along with that muscle we talked about. So highlight everything here. Over here, actually cross off, don't worry about demuscle the perineum. Everything else, though, would be fair game. Over here on this picture, highlight the following. These are things I want you to know. The fundiform ligament of penis, suspensory ligament of penis, the corpora cavernosa, spongy urethra, which is at the center of the corpus spongiosum. There's that septum in the scrotum that I was talking about, the thing that divides it into two sides. The cremaster muscle, that's the muscle that helps lift the scrotum and the testes up when the male is cold. The dartos muscle, which is just interior to the scrotum, is what causes it to wrinkle up. So highlight it, and then just the scrotum is fine. You don't have to worry about the skin part. Over on the right side, where we've kind of dissected things away a little bit more, the spermatic cord, you can see is circled, so that's kind of handy. Cremaster muscle has been cut away. Don't worry about that. Do highlight the ductus or vas deferens. It's kind of hard to see, but it is in there. Don't worry about the other stuff, the arteries, veins, and stuff like that. So you can skip down from the vas deferens to the epididymis. You can just see the head of it. Remember, that's a posterior structure, so we can see it better in the posterior view. Tunica albuginea and the vaginalis are visible. Highlight those, and that will be good for that picture. Picture down here on the bottom right from the cadaver. I just kind of like to show it, not to give guys nightmares or anything, but to show the three chambers very nicely. Over on the left side is a posterior view where you can see kind of the big reason I like to show it. It shows how those nice vas deferens come up and then fatten out, forming the ampulla. On both sides, you can see the seminal vesicles really nicely, where those ducts merge, forming the ejaculatory ducts. We have two of them that dump their secretions, sperm from the vas deferens, seminal vesicle secretions from the seminal vesicles into the prostatic urethra, and then that will, along with the two Cowper's glands, bulbourethral glands, essentially for the entirety of our semen. And then obviously prostate as well contributes to it. Now, speaking of semen, we'll talk about that here on this next page. As far as this picture goes, don't worry about it. It's not my favorite picture. I just kind of like to point some stuff out on it. We got enough pictures on our reproductive system to worry about. All right, let's talk about sperm and semen. Each day, about 300 million sperm complete the process of spermatogenesis. Remember, spermatogenesis stands for sperm formation. Think about that number, 300 million every day. Now, this starts when a man hits puberty, and it continues throughout their lifespan. You know, even when they're 100, they're still producing sperm. So technically, you know, a 100-year-old man can make babies, although their sperm are not, you know, as prominent and as, you know, vital as when they're in their, you know, most reproductively prominent years. The sperm is about 60 microns in length, contains several structures that adapt it for reaching and penetrating the egg cell, which is the whole goal of them. The two parts include a head and a tail, bracketed off here very nicely. The head is very important because it contains the nucleus, which we learned the nucleus of all cells contains DNA or chromosomes, in this case, which are the DNA wound up. The number of chromosomes is kind of unique in sperm and eggs. It's 23, whereas, you know, any other typical cell, whether it's a neuron, a muscle cell, a bone cell, is going to contain 46. Now, 23 is half of 46, and both egg and sperm have 23, and that's going to unite and form 46, which is what we find in our zygotes. Remember, a zygote is the cell that we all begin our life as, which means that it contains half of the chromosomes from dad, half the chromosomes from mom, making us, you know, half genetically mom and dad. Covering the anterior 2/3 of the nucleus is what we call an acrosome, a cap-like vesicle that's filled with enzymes that are released and help it to penetrate or kind of burrow into the egg. It performs what we call extracellular digestion, which is kind of cool. The tail consists of several parts. The constricted beginning is called the neck. It's just behind the head, containing centrioles that form the microtubules that comprise the remainder of the tail. The middle piece is where you find mitochondria, which we know mitochondria are the powerhouse of the cell, providing energy, in this case, that is needed for the cell, the sperm, to have locomotion, to be able to swim. Principal piece is the longest portion, and then it tapers and kind of creates this whip-like end piece, the terminal tapering portion. Okay, now sperm is not the only thing that is released when a man ejaculates. As we know, there are fluids coming from several different glands, the prostate, seminal vesicles, and the bulbourethral glands. When those secretions mix with sperm, you have what's called semen. It's actually about 90% other stuff and then about 10% semen. Typical volume is about 2.5 to 5 mils, and each of those mils contains about 50 to 150 million sperm, which is an incredible amount. Think about this though, only one sperm is needed to fertilize an egg. So, you know, making a baby and then produce lots and lots of cells that, you know, don't end up, you know, contributing to the making of the baby. Semen provides transport medium, nutrients, and protection for the sperm, and coagulates, or as I told you earlier, clots after ejaculation due to clotting proteins. As far as the pictures, I do want you to know this one, I would say everything would be fair game in it. And then these two pictures, this is just like the one that we started when we talked on this page about. This is what was at the end of the last lecture as well. So this is just a cadaver version of that. Some things are a little harder to tell, but everything's there. It's kind of cool to see. And then this is just that same posterior view where you can see the vas deferens coming up and around. There's the two seminal vesicles. There's the prostate. It's kind of more from the superior view, although it says posterior, it's kind of from above looking down. So we can't really see the inferior parts like the penis and stuff like that, but still kind of cool to see. Not stuff I'll ask you to know for the exam. With that said, we are done talking about men, and we can now move on to females. We'll start the same way we started with men. We'll talk about the primary sex organs of a female, or gonads, which are the ovaries. And then we'll move on to the secondary and accessory reproductive organs. Here more so on the next page. Ovaries are quite a bit simpler as far as anatomical makeup than the testes are, although the ovaries are a lot more physiologically complicated. So for those of you who are in physiology, you'll have that to look forward to this afternoon. Okay, ovaries are described as parent glands that are the site of gamete production in females. I don't have it listed, but the production of eggs or ova in women is what we call oogenesis. So spermatogenesis was the making sperm. Oogenesis or oogenesis is the production of eggs. Talked about the ovaries previously when we talked about the endocrine system. We learned that they produce hormones like estrogens and progesterone. We're kind of focused on their production of gametes at this point. Ovaries are held in place by a series of ligaments, which includes the broad ligament, a fold of the parietal peritoneum that attaches the ovaries or to the ovaries by a double-layered fold of peritoneum called the mesovarium. The ovarian ligament anchors the ovaries to the uterus, and the suspensory ligament attaches the ovaries to the pelvic wall. Some of those are kind of visible here, kind of in various points. This is that same figure from our last lecture. We'll kind of point some stuff out. This is a superior view looking down into the kind of pelvic cavity area. We can see the ovaries very nicely. There's the uterus. We can see some of those ligaments. And then this is a really good image where we can see kind of everything that's internal, which includes those ovaries. There's the ovarian ligaments. We'll talk about this picture a little bit more here on the next page. Just like the testes, there are two tissues that are on the outside of each ovary. A germinal epithelium, which you can see is labeled here in our picture, where the ovary has been opened up. That's just an outer layer of simple epithelium. I would highlight that here. They don't show you, they don't label it, they don't draw it in for whatever reason. The tunica albuginea, which is actually inside the germinal epithelium, and it's a fibrous layer. But those enclose the testes and separate the outside from the two inner parts, what we call the ovarian cortex and the ovarian medulla. This is just the distinctive parts to the ovaries. The ovarian cortex is a lot more complicated. This is where you find the egg cells going through their development. Each of these little things called follicles is a bubble-like structure, and inside is the oocyte, the egg cell that's developing and maturing, and that eventually will be released or ovulated, as we like to describe it, where it's pushed out of the ovary into the fallopian tubes. Okay, so the ovarian cortex region just deep to the tunica albuginea, consisting of ovarian follicles, surrounded by dense irregular connective tissue containing collagen fibers and stromal cells. The medulla, it's really not a whole lot going on there. It's loosely arranged connective tissue with blood vessels, lymphatic vessels, and nerves. Not my favorite picture, but you can see the major parts to the ovaries. So highlight just the three things that I mentioned: the germinal epithelium, the ovarian cortex, and the ovarian medulla. On this picture, that picture that we saw last time, and we get to see it again here, I do want you to highlight the following. Some of these we'll talk more about on the next page, which includes the uterosacral ligaments, the posterior fornix of the vagina, and then on the right side, I would highlight everything with the exception of the pubic symphysis. I'm not worried about your melon. And like I said, we'll talk about a lot of these things on the next page. Some of them we talked about last time, like the bladder and the urethra. Remember, that's completely independent structure in females from the vagina. This image, I really mainly include it to kind of show you the relationship between where things are in the abdominal pelvic area, down towards the pelvic cavity. This is anterior, as you can see. This is the ab muscles. Just deep to those are the bladder, or would be the bladder. Then posterior to that is the uterus, and then posterior to that is the rectum. So you can kind of see where things are in relationship to one another. You can see some of those very nice ligaments that were listed or talked about at the top, along with some ligaments that we'll talk about on the next page. But it's not an image I'm going to ask you to know. The main image is this one and the one on the next page. This picture is just from a cadaver, essentially the exact same thing as what you see here. So, a lot of similarities, obviously. Kind of tougher to tell things apart, though, so not something to ask you to know. My favorite image for the female reproductive system, the internal structures anyway, is here on this page, where we continue talking about more female reproductive system structures. All right, let's talk about the uterine tubes, also known as fallopian tubes or oviducts. And I really kind of just use those all interchangeably. So you'll definitely want to know them all. These are the active conduits for an ovum to reach the uterus. The ovum is a mature egg that is ready to be or has been fertilized. They transport that secondary oocyte that was what we showed here as being ovulated out of the ovaries away from the ovary toward the uterus. 3 distinctive regions exist to each fallopian tube: an infundibulum, which contains pulsating cilia. So the cells have cilia, little hair-like extensions that draw that secondary oocyte into the uterine tube after being expelled from the ovary. Associated with the infundibulum are these little finger-like extensions called fimbriae. Fimbriae just to help attach to the ovaries. Ampulla is the widest and longest region, and I would definitely highlight this is typically the site of fertilization by sperm. The isthmus is the narrow region that leads to the uterus. Okay. The wall of the uterine tubes consists of 3 layers: an outer serosa, which is just serous membrane; the middle muscularis, which is made up of 2 smooth muscle layers that propel the oocyte forward; and then an inner mucosa that consists of ciliated columnar epithelial cells to help propel that oocyte forward. There's also secretory cells that lubricate the tube and nourish that oocyte. Okay, the uterus, also known as the womb, is a thick muscular chamber that functions to harbor the fetus, provide a source of nutrition for it, and expel it at the end of its development. That last little bit is kind of just a really unfancy way of saying, push the baby out when baby's ready to be born. 3 regions to the uterus exist: a dome-shaped superior region called the fundus, kind of a middle, what we call body, and then a kind of tapered cervix. The cervix you hear a lot about is involved, especially during childbirth. I'll talk a little bit more about that here in just a second. The uterine wall consists of 3 layers, and they each have a special name, all of which end in metrium. A peri, a myo, and an endometrium are the 3 layers. Perimetrium is the serous membrane that lines the outside. The myometrium, remember myo, always remember muscle. I've talked about that many times this semester. This is made up of smooth muscle, helps with childbirth, and this is by far and away the thickest part of the wall. Kind of like we learned that the muscle in the heart was the thickest layer. The myometrium is the thickest layer, and this is what contracts to push the baby out. When a female is going through labor and they're having those contractions periodically, this is what's causing that painful sensation that females experience. The innermost and inner lining of the uterus is called the endometrium. Endo means inside. It's a highly vascular mucosa, so it's a lot of blood flow to it. Consists of 2 layers, one of which is shed when a female menstruates. So this is where the bleeding comes from every month when a female goes through her menstrual period. And Then they spend the rest of the month developing the back just to do it all over again. Talk a little bit more about the cervix. It's a narrow region at the bottom of the uterus that leads to the vagina. Cervical mucus secreted in the cervix protects against bacteria that enter the uterus from the vagina. The cervical canal is going to open into the uterine cavity at the internal os, shown right here. And then the external os is what leads to the vagina. This opening here is what must dilate when a female is undergoing childbirth. They say it begins about the same width as your pencil. Okay, so what is that? Maybe a centimeter. And then they say it has to dilate several centimeters to the point where it's going to go the same width across as like the baby's shoulders. That's probably the widest point of the baby's body. So very, very, very stretchy. Thankfully, things are going to eventually go back into place, but not, super, super right away. Several ligaments that are either extension of the predoperitoneum or fibromuscular cords help maintain the position of the uterus, which includes a big pair of what we call broad ligaments. We can see one on this side's labeled that would be, this is over here. There's also the uterosacral ligaments, cardinal ligaments, and round ligaments. You can see some of those here. There's the uterosacral ligament. It's kind of a funky direction which they're looking. You can see it's kind of from back, but a little bit with the body going up like this. Some of those ligaments were more visible here in this page. There's a uterosacral ligament. We can see some of them here, but once again, that image isn't the one I want you to worry about. Okay, that then leads us to our final structure, the vagina, also known as birth canal, which is a tube that allows for discharge of menstrual fluid, receive the penis and semen, and birth of a baby. The interior wall of the vagina is able to expand because of rugae. Rugae, we learned, are found in places like our bladder and the stomach, kind of the same feature, transverse folds, accordion folds that allow it to stretch. The wall of the vagina consists of 3 layers: an outer adventitia that holds the vagina in position, middle muscularis consisting of 2 layers of smooth muscle permitting expansion of the vagina during childbirth and sexual intercourse, and then an inner mucosa, which has a special form of bacteria that act on glycogen that's stored here from those mucosa cells, which causes an acid solution to develop, which lubricates and protects the vagina against other microbial infections. A recess called the fornix surrounds the vaginal attachment to the cervix. You can see the lateral fornix is labeled here. This is where a contraceptive device known as a diaphragm would go and would prevent any sperm swimming up and eventually fertilizing the egg back up in the ovaries, or excuse me, in the fallopian tubes. As far as this image goes, definitely an image you're going to want to know. I would put a big fat star just somewhere on the page because it's everything fair game, we would say, for the exam. Okay, so those are the very important internal reproductive structures. We still have yet to talk about the female genitalia, though. What we call the vulva or pudendum. And I have a picture here on the following slide, or last slide, that shows many of these structures, but I really don't like it that much. So I have pulled a picture from our coloring book to color. So we will color one last slide. And we have a lot to color, actually. So All right, I'm gonna go ahead and slide over to our document camera. Here we go. What I'll do is I'll just color code, then I'll just kind of talk about the things as we go through. So my first structure to color will be baby blue, labia majora. Go with this orange color for the menorah. Over here on the right, I'm going to color the frenulum. This kind of cool gray as it's described here. The vestibule, I'm going to color this purple color. Associated with it, the external urethral orifice, I'll color pink. Let's go this kind of light aquish color. The vaginal orifice will be this aqua. I'm gonna go black for the hymen. Structures of the clitoris. Let's see, I haven't used yellow yet, so I will color the glands, clitoris, yellow. Let's see, how about this light green? The body, I'll go with this light green. And that darker blue for the clitoris. Vestibular bulbs, I'll go kind of dark brown. Oh, and I missed the prepuce, so I need to add that in there. Let's see, I haven't used red yet, so I'll go back and add the prepuce to be red. And greater vestibular glands, let's go with find a color I haven't used yet. About like peach. Okay, at the bottom here, we've got two different images that I'm going to be coloring, showing you a surface or external view here on the right, and then a dissected view on the left. The area of the body we're looking at would be what we call the female perineum, basically, what you can see, figure out where we're at here. First thing that's actually listed here as part of the vulvar pudendum is the mons pubis. It's not going to be something I'm going to color because it's already labeled for you. A region of adipose tissue that's above the vagina, covered with hair, and functions to cushion the pubic bone and aid in lubrication. So the first structures to color are these very large, what we call labia majora. Now the term labia is plural. Labium is singular. Majora is also plural. Majus would be singular. So if you actually like go back to the previous slide, actually 2 slides ago, they have it listed here as labium majus, a labium minus, that would be singular. You know, we're only looking at half the body here, so that's where those terms come from. Now, the labia majora are a pair of thick folds of skin and adipose tissue bordering each side of vagina, where hair, sebaceous, and pseudorifus glands are present. Okay. Medial to those are the labia minora. Letter F. Which are the first things that I can color over here in our dissected view. Although part of it's been removed over here on the left side of the image. These are going to secrete an oily substance, and hair is absent from them. They are analogous to the spongy or penile urethra in men. Medial to them is the space known as, is the structure known as the frenulum, letter G. right there and right over there. Now the space that I wanted to talk about is the vestibule, area between each labia minora. Which is labeled as letter N in our picture. This is where you find the external urethral orifice, the opening that receives urine, which is the superior smaller hole. Letter O in both pictures. And then inferior to that is the much larger, which would make sense because this is where the baby would have to come out or the penis would have to go in, is the vaginal orifice. And we see that in both images. Although in this image here on the right, it includes something surrounding it, what's called the hymen. Okay. What I'm coloring now, the hymen is a thin fold of vascularized mucous membrane found within the vestibule, typically associated with non-sexually active females. Okay. Overall, what the vestibule does is it just encloses the vaginal and urethral openings, orifices, and the ducts from the greater vestibular glands that we'll talk about. Okay, our next structure to talk about will be the clitoris, structured like the penis, except there is no urinary role, and so its function is entirely sensory, serving as a primary center for of erotic stimulation in females. Layer of skin called the prepuce of the clitoris is formed at the point where the labia minora unite, and it's going to cover the body of the clitoris like so here in our picture on the right. They show it over here. I'm not even going to worry about coloring it over there because you can't really see it that well. So that's the prepuce. Let's talk about the clitoris, which is actually a three-part structure, kind of like the penis was a three-part structure. The final structure here to color in our surface view is letter I, the glans clitoris, equivalent to the glans penis in the man, therefore contains very sensitive tactile receptors. The rest of the structures will be colored over here on the left side, which includes letter J. Letter J is the body of the clitoris, passes inferior or internally inferior to the pubic symphysis. It then forks, which is what we call the crus clitoris. The crus, letter K. Crus is plural again, cura is singular. Letter K over here on the left side is very visible. We can't see the entirety of it over here on the right side of the image because it's covered with some muscles and other structures, but we can see the very end of it. It will focus back up. Sorry, those blues are a lot more similar than I was thinking they were. Both the crus clitoris and the next structure I'm going to color letter L, that will focus, undergo what we call vasocongestion. Oh my gosh. Vasocongestion is just a fancy word that means they engorge with blood, just like the penis does in men. So females kind of have an erection type situation, which allows the vagina to kind of tighten up. Okay. The vestibular bulbs or bulbs of the vestibule are two elongated masses of erectile tissue that are deep to the labia, lying on either side of the vagina. Okay. And we can see parts of them here in our picture on the left. They are analogous to the corpus spongiosum and bulb of the penis in men. And we've removed part of it over here and so that we can show letter M, to our final structure to color, which is a greater vestibular or Bartholin's gland, which opens by way of ducts into the lower vagina, which functions to secrete mucus that lubricates the vestibule during intercourse. These are analogous to the bulbal, urethral, or Cowper's glands in men. And there's also several lesser vestibular glands that also open in the vestibule that are small that you can't color. Final structure of the paraurethral or Skene's glands, mucus secreting glands that are in the wall of the urethra, hence the name paraurethral. But they are analogous to the prostate. So I included them, and along with a lot of other structures, I included what the function of these organs are, but also what they are analogous or similar to in men. So you can see a lot of similarities, even though there's very, very big differences between men and women. Any questions on any of this stuff here? All right, we will move on to our final slide. Something we've talked about before, an area that we call the perineum. In fact, that picture that we just looked at, those two pictures we were looking at, the female perineum, which is a diamond-shaped area medial to the thighs and buttocks of both men and women, so males and females. In fact, we saw the perineum, talked about the perineum first back in our muscle lecture, skeletal muscle lecture. I showed you, I had a picture of both the male and female perineum and all the muscles involved. Perineum is a very important region because it contains the external genitalia and the anus, things that we've been talking about fairly recently or in this lecture. Bounded anteriorly by the pubic symphysis, laterally by the two ischial tuberosities, the bumps on the bottom of the hip bones, and then the coccyx or tailbone. So it's a diamond-shaped area, but if you draw a line across from ischial tuberosity to ischial tuberosity, it splits that diamond into two triangles, a urogenital triangle, which is where the urinary and genitalia structures are. In this case, the female urinary and reproductive structures, a lot of those things we just colored. And then the anal triangle, which is where the anus is. Okay, pretty simple, straightforward there. This is that image I said that the textbook has that I just don't really like the best. So I'm not going to worry about you knowing like all these things that we just identified. What I want you to know from the picture is just the urogenital triangle and the anal triangle. Pretty dang simple, I would think. And that leaves us here with one last thing to talk about. The breasts and mammary glands, which we find only in females. All right, we're reading through. A breast is a hemispheric projection of variable size on the chest. Each of our breasts is located anterior to the pectoralis major and serratus anterior muscles, two very important prominent chest muscles on each side. They're attached to them by a layer of fascia composed of dense irregular connective tissue, which you can see is not really labeled in the picture, but that's okay. What is labeled is something very important. What we call this suspensory ligament of the breast or Cooper's ligament of the breast, a strand of connective tissue that helps run between the skin and fascia and supports the weight of the breast. This is the structure that unfortunately starts to wear out or kind of stretch out as females get older, especially those very big chested women, those that also kind of choose not to do a good job of wearing a bra in their younger years. And that's what can contribute to the sagging situation that older females typically suffer from. Breasts themselves consist of one nipple and a mammary gland, but we're talking only in females having mammary glands, men do not. Let's talk about those mammary glands. Modified sudoriferous or sweat glands specialized for the production of milk. We learned that back at the beginning of the semester when we first learned about glands. Each mammary gland consists of 15 to 20 lobes separated by a variable amount of adipose tissue or fat tissue. Each of those lobes is composed of several smaller lobules, and those are composed of grape-like alveoli, because why not name something else alveoli? We just recently talked about the alveoli in our lungs. We also learned about the alveoli, which were the sockets in our jawbones that support our teeth. In this case, alveoli, and it's something very, very important to highlight, are the bulb-shaped glands where milk is produced. So this is where milk is produced in females. Surrounding them, and it's not shown, but very important, are myoepithelial cells that contract and force the milk out into a series of ducts that are going to filter that milk towards the nipples. The milk will travel from the alveoli into secondary tubules, which then converge and form mammary ducts. Mammary ducts then carry the milk to lactiferous sinuses and out to the surface of the nipple by way of lactiferous ducts. So basically, I just kind of pointed to all this stuff that's listed here in this section of the information. The nipple itself has the openings from those lactiferous ducts. About 6 to 8 of those openings exist, all in that same nice area. That makes it really efficient for getting the milk to the baby. Presence of sebaceous glands makes the texture of the nipple coarse. And there's also surrounding the nipple the areola, which is a variable size pigmented area, which appears rough due to modified sebaceous or oil glands. As far as the images go, this is a sagittal section, so you're looking at half of the breast that's been cut in half, and then a frontal section where kind of part has been removed, the skin especially. What I want you to know is really kind of here in the middle of the picture. I would highlight everything with the exception of the pec major muscle and then the adipose tissue I'm not worried about. And then on the far right, areola and nipple are labeled. Highlight those. Those are probably pretty common sense though. And with that, we are done.